Maurizio Scarpa. I'm a pediatrician, metabolic pediatrician. I'm the director of the Regional Coordinating Center for Rare Diseases at the University Hospital in Udine and the coordinator of the European Reference Network for Inherited Metabolic Disorder, MetabERN.
Hello everyone, my name is Professor Jim Bonham and I'm president of the International Society for Neonatal Screening.
What is the newborn screening?
Newborn screening is a revolution in public health because it is aimed to detect lethal disorder pre-symptomatically, to prevent life-threatening events in newborns, and to potentially treat life-threatening diseases. It started in 1960 with the detection of phenylketonuria after the discovery that the phenylketonuria can be treated with a diet.
How does the genetic newborn screening work?
Conventional newborn screening relies upon the detection of a metabolite or a compound that's directly related to or strongly associated with the condition that we're trying to detect. So we, generally speaking, will see an increased concentration of that compound in a blood spot or a blood sample, and that allows us to identify the condition. The genetic newborn screening takes a step away from that and is looking at DNA, either by techniques such as whole exome sequencing or whole genome sequencing, or using panels of variants. And it can be conducted rather than by getting a blood spot from the baby, although that can also be used. It can also be conducted by getting a buccal swab, or perhaps getting a cord blood sample, and there are examples of that going on around the world as we speak.
What are the potential medical benefits of early detection through genetic newborn screening, and what are the limitations?
The potential benefits are, of course, those that are already associated with conventional newborn screening. That is, that we can detect the condition much earlier, we can detect it in asymptomatic individuals, and we can get those babies onto treatment much more quickly. And that, generally speaking, ensures a much better outcome. The benefits are also, of course, that we can screen for more conditions. The limitations are really understanding the interpretation of the data. While there is a considerable evidence base for us to understand biochemical screening, that evidence base is not there, it's just being assembled with genomic newborn screening. The other determinant is, even if we know that the mutation is pathogenic, then of course we don't necessarily know the penetrance in an asymptomatic individual. And what that means is that while they may have the variant, they may not necessarily express the disease. And of course, then it's sometimes difficult to predict whether that patient needs treatment or not.
What types of conditions can be identified, though, genetic newborn screening? And how do the newborn screening programs vary across Europe?
The disorders that can be identified by genomic newborn screening include those, many of those, that are already detected by conventional newborn screening. Not all of them, but many of them. But of course, it takes us much beyond that. So in Europe at the minute, for instance, we screen, in some cases, it's a surprising variety, but in some countries, we're screening for a handful of conditions, fewer than 5. In others, we're screening for around 50. And we can imagine that when we begin to do genomic screening, that difference, unless we handle this carefully, that difference might increase. So genomic screening gives us a potential to move that 50 conditions to 500 conditions. And of course, that is going to require some careful planning.
How do you communicate newborn screening results to parents, especially when results indicate a rare condition?
The newborn screening is not just a test, it is a system. So the newborn screening needs to be communicated when the mother is pregnant to the couple, in order that they understand that when the baby is born, there will be the possibility to test the presence of lethal disorders in a pre-symptomatic moment. in any moment, from the communication before the delivery to the delivery and after, when there is a diagnosis, an expert in rare diseases must be present, and an expert in genetic diseases must be present, in order that the family receive complete information regarding what is a newborn screening, how it is performed, and what is eventually the consequence of the detection of the disease. This communication is fundamental, and it is the only way for the couple to resist to the communication of the rare diseases and to be taken as a follow-up by specialists and to treat, if possible, the child.
Hi, my name is David and I'm the father of 2 children with Dent disease. When my children were young, I had no idea about the possibility about screening for genetic disorders, and I advise strongly now to freely make screening for newborns available freely in Europe, because within the Dent community we believe the actual prevalence of patients with Dent is much higher than the actual figures suggest currently. There's a lot of people walking around with Dent disease without knowing it. And of course, screening on newborns for genetic disorder will solve that problem. When people get an early diagnosis, that will save a lot of problems. They can get care from the start, limiting their symptoms, or maybe stopping certain symptoms. But it also will save a lot of cost for society. I mean, there's now a lot of unnecessary therapies and treatments because people do not have the right diagnosis. So, from the Dent community, I strongly believe in screening for genetic disorders on newborn. Thank you.